Actually,
my
mushrooms.
favorite topic. You can't digest mushrooms. You can't digest. The classic picture, I have one patient who basically had vegetables that was not digested and it covered the wall of the toilet.
Wait. Sushi causes worms?
Sashimi lah.
Causes worms?
Patients who done the food allergy test and are like, oh my god, this changed my life. I avoid all these foods and my bloatedness is gone. Blah, 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 blah. I'm like, really?
Everybody run your own race. Don't
Sort
poop
of.
like somebody else does. Alright, ladies and gentlemen, we are here with Dr. Sharon Koh, and
Hi.
she is here to tell you everything you need to know about your bum bum. Alright, so Sharon, can you tell us a little bit more about what you specialize in?
So I'm a general surgeon with a subspecialty in colorectal surgery. And a lot of people ask me, why did I choose that? I kind of like to keep it a simple line. Like he said, bum. My pet term is butts and guts.
Butts and guts.
Yes, because they tend to like, what kind of doctor are you? Oh, you're a surgeon. Okay, what kind of surgeon? I go, okay, time to go start going,
People always
seriously.
imagine it to be very fancy, very clean.
Yeah,
But when you
but
say
yeah,
butt
why
and
did I
gut-
choose butts and guts?
Yeah.
It encompasses everything, doesn't it? The butt and the guts.
Yeah, so why?
Why? I like it. It's a common. I think a lot of people do suffer from colorectal problems. Even when you go down to the bum, people suffer from piles.
Yeah.
Bleeding, pain, literally pain in the ass. Can I say that?
Yes.
I can, right? Yeah.
Yes.
And I think it's a common problem but people don't really like to talk about it.
Yeah.
It's not so open. So if I can help them along with it, with a common problem,
Yeah.
I think why not? I think
Yeah.
it's good. And also like colorectal surgery, colorectal cancer is one of the commonest cancers. Not only in Singapore but in the world. It's equally common in men and women. And then I think it's good to deal with something that's common in the population. Yeah.
So I believe you scope on a daily, scope very, very frequently.
Yes.
Or-
Well, not almost daily, I would say. Yes.
Daily?
It's a bulk of my practice is doing colonoscopy.
Yeah.
Yes.
Who are the people that's referred to you?
Who are the people
Are the
that's
are,
referred
are
to
the
me?
people who are referred to you
Interesting.
already have colon problems and need them cut out, or are they the ones that come in with tummy pain and don't know what it is?
I actually get both.
Both.
So I do get people with tummy pains
Yeah.
or problems. Actually, honestly, like the digestive tract having problems, passing motion, constipation, or even diarrhea, alternating bowel habits, bloatedness, tummy pain. I think that's really quite common, and I'm actually hearing more with people who are more interested in their digestive health,
Yeah.
as well as all these changes. To the point that even people are interested in food allergies, what's
Yes.
causing all these things, which
Yeah.
I think 10, 20 years ago,
Yeah.
we don't really hear that.
Yeah.
But now people are more interested, especially with the people talking about the microbiome,
Yes.
all the gut bacteria,
gosh.
how it
I need-
plays, the
I
role
need
it
to
plays.
know all that.
Everybody starts asking questions about it. So yes, I get all sorts of referrals. But
Okay.
essentially, they come in with this kind of problems. But I also
Yeah.
have the
Yeah.
common problems.
Yeah.
I got issues
Okay,
down
you know
there
what?
lah, the bum
since
lah.
since we're talking about
Yes.
it now, can I ask you?
Yes.
Can what you eat help you with your gut?
That is actually a very loaded question.
Yeah, very
I
vague.
would say yes.
Okay.
Definitely what goes in makes a difference.
Okay.
I think the quintessential thing is how it makes a difference.
Okay.
It's the part that I think nobody really has an answer to, unfortunately. Because it's, first of all, quite a long track, right? And everybody's different. So I can give you the exact same thing. You can have it with all of us in a room, and
Yeah.
everyone's going to have a different reaction to it.
Yeah.
That's why I think with the people doing food allergy testing and even other tests gives you more idea. But it's such a huge spectrum out there. People are even testing like the microbiome, testing your stools to see what's happening in there.
Yeah.
So I think the diversity creates the challenge. Yeah, but I do agree that definitely what foods you take will affect people differently.
Okay.
And it does play an important role
Okay.
in gut health, I think.
Yeah. If I have got cancer,
Yes.
colon cancer,
Yes.
that is, what I take is important.
So if you already have, as in if you have colon cancer now, has it been addressed? Has it been removed? Have you been cured? Or are you saying that you're actively having the colon cancer right
I think
now?
actively having colon cancer now.
I think what you take will make a difference because, again, what treatment are you on? If you're on chemotherapy, if you're on that, then certain foods, even medicines will interact with the chemotherapy.
Yeah.
And also it depends on whether the cancer within you is causing any problems. I mean, if it's a very big cancer and it's like almost blocking the entire lumen or the the tract, then usually I tell my patients that you may need to actually avoid high fiber foods to overload the colon. So I give the example of like, you're on a road and it's a three-way, there's three lanes, and then now that because the cancer is blocked up 2 lanes, you only have 1 lane left. You don't want to like
continue to clog it.
Yeah, you don't want to continue to clog it. So in that sense, then the diet needs to be modified.
Oh, okay. I thought you're saying, I always imagine fiber is how it goes in and it's like razor blades cutting your colon. If you have an ulcer over there,
Yes.
it will cut your
I would say
colon.
fiber itself is a bulking agent, like it bulks the stools,
Yes.
which also then has a double-edged sword.
Okay.
So why I actually say that is because some people say, well, I'm constipated, I need a lot of fiber. But I usually tell my patients that you need water or you need fluids as well. Because if you overload on the fiber and you avoid the fluids, you're basically just, as you said, it becomes like razor blades and cutting because you are just bulking it up without giving it enough, lubrication yourself to pass it through, and it actually causes more problems. Which is why for patients, let's say you have a large obstructing cancer, or when those were going for colonoscopy, we said avoid fiber because you want to avoid overloading the colon with so much bulk.
Traffic.
Yeah, exactly, traffic. Yeah, that's why. Yeah.
On the topic of microbiome, I think
Yes.
you mentioned it.
Oh no. Yes.
Is it medically proven, or is it just what some people believe that will help your gut?
No, I actually think that it is medically proven.
Okay.
And I think I've always been, there's a big
Yeah.
Netflix show
Yeah.
coming up now, which I've been telling myself to watch it. It's on Netflix now. I mean, about the microbiome.
Oh, what's it called?
It does. I forgot the name of it. but
Okay,
it
I'll
is-
go
it's-
Google
I mean, it is. And it's
Yeah.
on my to watch list, which I
Yeah.
haven't watched it yet.
Yeah.
No, I think if you go into the details of it, it's huge.
How does microbiome in your gut health help your digestive tract?
It's not just that. I don't think it just helps with the gut health. It even helps with the entire it almost feels like the gut has its own system on itself. Like it affects your mood, affects your.
It's like the temple
it's
for your
like
body.
It does. And I think we only tapped. Like for me, we only deal with the fact of the transit thing from the mouth to the anus, what goes through. I think there's a lot more to it than It's like they have their own neural system, like own little brain and everything inside itself.
Yeah.
So I think if you ask about the microbiome, I think that interplays because imagine the amount of things that are happening in there. It's literally a little ecosystem, a like mini universe down there.
Yeah.
And I do know that a lot of the gastroenterologists are also into that because they study that.
But
And I
isn't
think,
it the nutritionists who know the details on those?
I think we need to work together. As of now, I think the part that we actually avoid is people need to come together to work together. We can't do it in silo. Like I think you are right. The nutritionist has to come in, the gastroenterologist has to come in. Sometimes we have to come in and things like that to make it work. So in terms of how to advise people like what foods to take, I tend to refer out to the nutritionist as well because sometimes it's a bit difficult. It's not a one shot, I'm going to tell you this is the perfect thing to work and go. But I will say the commonest question I get asked is, what foods can I eat?
Yes.
What foods can I not eat? Then I'll be like, let me see. I can give you the sort of certain guidelines, but most of the time you want to go in detail. Probably the nutritionist would definitely be better at it than me.
I don't know how poor or good my knowledge is, but generally my idea of the health of your gut is based on your probiotics and prebiotics.
We do prescribe those, and but also again, this pre and post biotics actually only started recently. But if you think about it, right, 30, 40 years ago, nobody really takes it specifically, but it's already present in certain foods that you take. For example, like the preserve, like kimchi and things like that. They already have certain things there. It's just that people don't know it. They don't label it with a name. So essentially, I think in terms of what people have been doing have been right. It's just that they never termed it in that way that you mentioned. Or yogurt, for example.
So how about countries, for example, Korea, has a lot of kimchi, which has a lot of probiotics, right? Do they then have better gut health?
Good question. I have no idea.
Yeah?
I have no idea. But again, with all that, as you know, with all these preserved foods, right? Like Japan and Korea, they have a higher incidence of other types of cancer. Like stomach cancer. They actually have a screening program for stomach cancer in these countries that take a lot of preserved foods.
Oh, because of the preserved foods. Like their army stew.
I don't know exactly what foods, but they do have a higher risk of certain other cancers.
Heng, I don't eat Korean food.
I like kimchi.
Yeah. You like?
In moderate amounts, yeah. Okay.
Just no preserved foods in there.
Oh, it has some benefits lah. Okay, yes.
Okay, Dr. Sharon, do you watch your health?
Well, I hope so.
Your gut. What you eat?
I am not exactly super like obsessed with it.
Okay.
I think I'm quite lucky because I don't really have the common, hopefully it stays like that.
Yeah.
Common problems like the bloating or taking certain foods. I mean, I know that certain foods I take does maybe, like give you a bit more gas. But I look at it as all these are all normal physiology things, right? Everybody has gas. I speak to my patients, it has to come out either from the top or from the bottom. That's where all the bacteria are working. But do I look after? I will say everything in moderation.
Okay, good.
Don't overdo it.
I want to ask you, like, what is good practices for your gut?
What? Okay, that.
I would assume it's just consuming lah. There's no like. Actually, I guess exercising can help.
Okay, exercise definitely does help.
Definitely helps.
Moving. Okay, there's no scientific. I guess there are articles that say exercise helps. There are even articles that says drinking coffee helps. We know that. I mean, but based on your own experience, sometimes you do need that bit of coffee in the morning to get you going. People report that. Does it work? Does it work for everybody? No. So if it works for you, I say that's fine.
Wait, coffee helps or doesn't help?
Helps.
Oh, really?
Yeah, I've got more than... Okay, this is all anecdotal. I got more than one patient that says that.
Oh, with or without milk?
Oh, that one I don't know.
Okay.
I never asked anything like that. I don't know whether with or without milk. But,
okay, coffee helps.
Well, that's what more than one people tell me.
Like how?
So
just
caffeine,
flushing out
the
this?
caffeine. I have no idea. I really have no idea.
So do you then drink coffee?
I drink coffee. And I know coffee helps for me. That is anecdotal again.
Okay,
and
I'm going to be drinking coffee.
And exercise works. You need to move the body as well. If you are just lying in bed and everything just, it's not just your gut, everything just stops moving. So I do actually encourage, in terms of health, that yes, exercise, getting out there, getting some sun even, definitely helps with gut health.
Okay.
Or health in general.
Okay.
So it will help. In terms of bowel movements and all that, I do tell my patients that you get around and move more. It will help. Again, does it work for everyone? No. But when you encourage patients to do that, the feedback usually is that there is some improvement. For sure. Especially those who like post major surgery when they actually, let's say like you say cut out the colon and they're actually resting in bed. When they start to move out of the bed, they actually then everything starts to move better. Yeah. So that's the experience I have.
Okay. So some form of movement / exercising, consuming. But on the topic of consuming, you're saying that drinking coffee kind of gives. Well, it gives the study. There's a study showing.
I've seen articles on it, but again, is it like a recommended list? Like these are things that you should do, and it will work for everybody? I'll say no.
Okay. Then what is the recommended list?
I don't think there is a recommended list.
Oh, really?
I don't think there is. If there were, then
I
would have given the list to everybody, right? And then I would be out of the job.
Then like kombucha? No?
It's got probiotics. I think if it works, it works. It's almost like probiotics, right? So I do tell my patients and say, I do prescribe probiotics. And I tell my patients look, if it works for you, great, take it. But don't come with that, understanding that it's definitely going to work. I've had patients that walk and says, "Oh my God, this changed my life." I said, "Good for you. Continue. It syncs well with your microbiome with you. Please continue. If it doesn't, then just stop. Because I will not say, studies have shown that it definitely works. Please take it, even though it doesn't work for you. As I said, the things are too diverse. Everyone is so different. It's not a one list fits all for everyone. But if it works, go for it. But if it doesn't, I'll just say, forget it. Try something else.
But sometimes heng sui one, no?
It's heng sui. It's heng sui. It's true. That one and also food allergy. Same thing. I have patients who've done the food allergy test and they're like, "Oh my God, this changed my life. I avoid all these foods and my bloatedness is gone." Blah, 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 blah. I'm like, really?
Sorry, tell me more about this food allergy test.
It's a blood test that people take. It's the different amounts. It's a set list. There are like 60 foods. Oh, there are many companies doing it. Okay. So they're like, but this is not it's not like the peanut allergy, you need EpiPen kind of thing. It's different, those are the acute food allergy. Like, you can't eat the foods because you have a reaction to it. This food allergy it's a chronic kind of allergy. It basically means that your gut reacts in a different way, like it reacts negatively to certain foods. That's why you get the bloating, you get sometimes like loose stools, and because there's some mild inflammation happening that
Okay.
you're not basically
Okay.
gut is not happy with
Okay.
this lah. So it identifies certain foods that you are, well, there's a whole list
That you should not take.
that you should not take.
Really? Then everyone should do it.
It's not cheap lah.
How much?
It can
500
range for a
bucks?
few hundred to, if you do like all the full panel,
Yeah.
$1,000 for the ones that we do.
It's good. It's something that people should be doing.
It's
right?
something people can consider. That's what I tell them. But I also tell my patients this: are you the type of person that if you see the list and you go, I'm definitely going to avoid it because it's there, then
Yeah.
please do. If you are the type, like, you follow a structured. If
Yeah.
you say like, oh my God, that's my favorite food, I'm still going to eat it.
Yeah.
Don't waste
Yeah,
your
they
money.
don't waste money.
Don't waste
True.
your money. So you
True.
need to see and those people come back, they actually, so that's my first screening test. I mean, my screening point lah. Are you going to follow? And then those that actually follow, right? And I have more than one, which is why I continue to, I do offer it because I've had, again, this is people giving me the feedback that it really changed their life. Because essentially, what can I do? I can do the colonoscopy and do the surgery to solve the problem for you, but
Yeah.
a lot of these problems with like bloatedness, stomach distension, passing a lot of gas, it's very hard to find a treatment for it. My scopes are not going to cure that.
Yeah, they're not.
That's the thing. So if
The
you
blood
come
test will work.
it may not 100% work, but
Yep.
it may help for you identify certain precipitating foods. And especially if you already know, you suspect, I got a feeling I eat this cannot, I eat that cannot. Why not have a test to confirm it?
Yeah.
So in that sense, because I do have patients that says, oh, I already know I'm a bit sensitive to these kind of foods. By all means, they confirm it, especially if you are already disciplined enough to say, I'm not going to eat those foods.
Yeah.
So in that sense, we do have that. We do. And actually, the funny thing was, I'll be honest with you, like when I wasn't in private practice, we never did this. But it was like, as you go along, people tell you about it. The patients tell you about it. They actually come and ask you, can I do this test? I go, really? You really want to do this test? Let me have a look at it. It is quite interesting if you look at the list of foods.
Yep.
Because some of it will be like elk meat. Now I'm like, who in the
Elk
world
what?
eats elk
Elk
meat,
meat.
right? Or some other weird kind of fancy stuff. Yeah, but the funny thing is I actually seen quite a lot of people with egg allergy, milk allergy. Like it does confirm whether you can take the lactose, what kind of cheeses you can take. So
Okay.
it's quite interesting. Exactly how it works, again, I don't really know. And whether it works for everyone, not really. But it has worked for maybe about one quarter to one third of my patients, I would say.
Colon issues wise, right? For the colon, what are some of the more common diet restrictions that you've seen from the blood test? The most common ones on the list.
Quite a lot of it is the gluten, no?
Gluten.
The wheat.
I thought gluten was fake.
No, wheat. There's quite a lot. If you look at the list, it's quite interesting. There's a whole list of the wheat bread stuff that they can't
Really?
take. Milk is the other one. Eggs is the other one. So they actually divide into egg whites and egg yolk, and it's quite interesting lah. Then they tell you some certain spices, some people cannot take what. But I would see when you look at the food list, it's still more tailored towards the how do you say that, the foreign kind of foods.
Yeah.
Like the local, they haven't really looked into the local kind of spices, that kind of thing. So in that sense, maybe they haven't looked into the.
Wait. So you're saying that the blood test doesn't show whether you cannot eat local
That's
food?
not going to say mee rebus lah.
Yeah,
that's
mee
what
pork.
not going to say mee pork, but it was, then you need to find out what mee pork is made of.
Yes.
You understand what I'm saying,
Yeah.
right? Yeah. So
Yeah.
in terms of the kind of food things, I think that overseas people, I would say the Caucasians and all that, have been more into this for a way longer time.
Okay.
Which is why when you go overseas, people always ask you, what food are you allergic to? This question never came out until recently. Until the list is, what are you allergic to? Okay? But when you go overseas, they are very particular about that kind of thing. More so. And I think they are more in tune with what is in the content of the. Like, I don't know what's in yellow noodles. Like, your mee pork got what? I don't know. What is it made of?
Egg yolk flour.
What is it? What
Just
kind
roll.
of flour? Is it wheat? I don't know. I'm not a cook, so I wouldn't know.
No,
But you know that kind of thing.
neither am
So
I.
you need to find out the details. So I think that may be the challenging part.
Okay, so that's the more common ones, which you're saying is a lot of gluten, a lot of
That's what I've
eggs,
seen, yeah.
a lot of like Western products.
It feels more Western oriented than local oriented. If you know what I'm saying.
Yeah. What are the weirder ones? Like, you cannot eat that?
Actually, what are the weirdest? The only thing I thought was interesting in the whole list was elk meat.
Okay.
Sorry. And something else, I can't remember. I have to go and look at it again. But it's It's quite interesting. But this is only one company that we work with, because I'm pretty sure there are a lot of other companies, because I have patients bring the tests from other companies before. So I've seen there are a lot of different companies. I don't even remember the name of the company that I sent off to, but
Yep.
I'm sure there is quite a lot. And I think this will probably get more popular as time passes.
Yeah.
I think this will pick up. I feel that this trend of people looking into the foods that they take will pick up.
I think maybe when
It will
it's
pick
a
up.
bit more affordable.
Yes,
Like
or it's
$1,000
more
is
mainstream.
like
It's
quite
not,
expensive.
and the thing is, they can't use it. Most of the time, the question is people ask whether they can use their interest to clean. That's just a 50-50 thing. Not sure. I
Yeah.
cannot give you the direct answer.
You
to
know
that.
why? Because you know this like there's this company like Circles or something where they take your blood test and tell you like
Your
you are
DNA.
Chinese,
Yeah,
you
yeah,
are
I see
from
it, yeah, yeah,
Thailand,
yeah.
your
DNA thing,
father
right? Yeah,
from
yeah, yeah.
France.
Yeah.
Like people would bother paying money for that. That's super expensive, you know.
I don't know
to
how
do a
much it is,
test.
but I've
I believe it's like between $500 to
Circles.
$700.
Oh yeah,
Not cheap.
it's not cheap.
Then why would people not pay for this? To know exactly what your body is rejecting.
That is true. I
People
don't
pay,
know.
you know. I think there just has to be
more
awareness for it.
People are paying. I definitely see more people paying. Not the older generation, like our parents' generation, no lah. But the younger ones, they are asking for it. And I think a lot of this is word of mouth, as I see. Like I've got this patient who, the first one I said, she did it and then she brought all her friends. Can I help? Then they just came to do the blood test. Can you imagine?
yeah.
They're really just to
Yeah.
do blood test. I said, okay,
Yeah.
can. No, it's quite interesting.
Yeah.
Yeah. So that's the interesting part about food and how it affects gut health.
Yeah.
Okay, you know the pink ribbon, right, for breast
Okay.
cancer? Everybody knows about
Yes.
it. And it's
Ours is
October.
brown.
No, it's blue. Okay, brown is
Yeah,
not bad.
brown
actually.
makes sense,
It's
no?
blue. It's blue.
Okay,
Brown
blue.
cannot lah. Too graphic.
Yeah.
But blue is the navy blue.
Okay.
And I tell my patients, you see, nobody talks about the blue ribbon. It's the
Yeah.
same shape somehow. But anyway,
is it?
back to it. And how it plays with the colonoscopy being important for colorectal cancer screening, right? So then we talk about the foods cannot eat lah. Then the rest of what cannot eat. They find I think patients find the preparation. In fact, they find the preparation more difficult than the scope.
I agree.
Okay, who else? I've had my scopes done.
I've done many times.
Oh yes,
Yes.
you difficult. Yes,
I believe.
correct. You had
Yeah.
to do many times. Yes, so they actually find that the preparation is worse. Some people love it. They think it's detox. For the ladies, you tell them it's people come for elective they call it colonic cleansing, please. No,
Yeah.
people don't want they want to have the colon cleanse.
Horrible.
And then with no medical indication, I'm like,
They don't
no,
need
we
scope
don't
lah.
do it.
Just give them bowel prep every day they
No,
drink
some
lah.
people ask. They actually want to do it. No, God.
Oh.
Oh, this one cannot say it. No, but
Yeah.
I mean, they actually think, if you think of it as cleansing, but in terms of the preparation, there will be, as I said, you don't want to overload the colon. So there'll be a list of foods that my nurses will tell you a few days or usually up to a few days that you try to avoid lah.
Sorry, what do you mean by overload the colon?
Because if you overload it with a lot of fiber,
Fiber.
and of vegetables, which you can't take a few days before your scope,
Yeah.
bulking agents, then it's not going to be able to clear from the system. You see.
Yeah.
So essentially, you take it, if you're on clears for 1 week, let's put it this way, let's say you gastro and, like say you gastric flu or something, cannot eat anything, you just drink soup.
Yep.
You just drink soup for 5 days.
Yep.
You're not going to have stools, what?
No.
You're going to be passing out
Yeah.
stuff. Exactly. So that's what I mean, what goes in has come out lah.
Yeah.
So if you don't overload it with all the high fiber stuff, all the wheat stuff, things that bulk the thing.
Yeah.
Essentially, your preparation itself is easier.
Yeah.
Because I know that they always think that, and the other thing that patients tell me, I follow the instructions very carefully. Like I follow everything. How come it's still poor prep? Then I said, this is like, again, it also reflects on why everyone's different. Because from point A to, like from your mouth to the bottom, your anus, right? The length is different. The time it moves is different.
Yeah.
There is not going to be one fixed plan that's going to work for everyone.
Yep.
Some people may need more of the medicines to clear. Some people need less. So what we actually tell our patients is we have to stick to a standard thing. It's going to work for majority of the
Yes.
patients. It may not work for all.
Yes.
Right? So essentially, also, we don't want to give you, if I give you 10 liters of it, I'm sure everybody will have clear at the end of it, right?
Yeah, it'd be
But
super slim after that.
Nobody's going to drink 10 liters of that stuff
Goodness.
to clear the
Yeah.
everything. So
Yeah.
then the advice is usually to not overload the system, which is like, as we say, try to cut down on certain foods. So the main thing that you don't take would be vegetables, high fiber things. So no bread, no wheat, no anything that's bulky lah. So there's always a list of that, and avoid things that are seeds, corn. Well, I tell you why, mushrooms, my favorite.
Actually,
my
mushrooms.
favorite topic. You can't digest mushrooms.
I
Nama,
never
you
knew
can't
that.
digest- I can literally tell you how the mushroom is cut. Is it cubed? Is it
No
shiitake?
way.
No, I'm serious.
Wait, why can't mushrooms be
You
digested?
can't, no, if you don't chew it, if you don't actually chew the mushroom, it goes through the stomach. and it comes out from the bottom.
Oh, it's true.
It is true.
Can
I can tell you how the mushrooms are carved.
Can I tell you an interesting story?
Yeah, why?
So
You pooped out mushroom.
very often after Chinese New Year, I have a friend who is a gastro surgeon, right? He says that patients, a lot of old people, like to come in and then they got a lot of shiitake mushroom inside their stomach. All the old people, because they don't chew.
It's not that they don't chew. So especially those have no teeth.
Yeah.
Okay, then I tell you, I already told you,
so
I got pictures of, okay, I shouldn't be saying this. I got pictures of how, I can tell you ate the mushroom slice this, right? Oh, it's cute, right? It's shiitake, right? Because I can see the brown thing on top, right? I have seen corn kernels, quinoa. I've seen
quinoa.
And also I've seen chili seeds. So actually, curry leaves also we've seen before.
So is quinoa good for or not good for health?
It's good lah, but you don't take it before your scope.
Oh,
a few days before your scope. This is for scope ma.
Okay.
This is basically what I see when I scope.
Okay.
If you ask me what are the interesting things I've seen.
Yeah.
Oh, I've seen tomato skin also. So it's like, hey, then you're like, no, I didn't eat tomato. I said, oh, then after they think, oh yeah, but then now the soup got tomato. I was like, oh yeah, you drink the soup and never chew it. That's why it's out there. Those are the few interesting things that I've definitely seen when I do scope.
Yeah.
It's great. Meats you can take.
Yes.
You can take your proteins, you can take your meats.
I only eat meat.
Tofu, everything. So that's why I say if you are those that, don't really like fiber vegetables, but they're very happy to do scope, you can eat all that.
Yeah.
You can eat
Me
fish,
too.
everything you can eat. Anything proteins you can eat, but not anything that's, vegetables. Oh yeah, also vegetables, right? You can actually see the leaf part, you can see the stem. Sometimes they digested halfway, like all lei cai, right? Then you see this one got lei cai.
Got it. So scope prep, pre-scope prep, best is a meaty diet.
Meaty diet, you can eat less fiber.
No mushrooms.
You can eat eggs, you can eat tofu. Then, of course, I was asking my nurses today, I said, hey, what do the patients normally ask you all about this? Then they say, oh, the other thing is vegetarians. Then they say, oh my God, I can't eat veggie, how? Then you have your tofu, you can eat your egg, and all the other things. Still got a lot of other things you can take.
What else can they eat though, vegetarians? You say eggs, a lot of them cannot eat eggs,
Well, then
my mom's vegetarian.
Then anything, all the tofu, as long as not all the
tofu.
I think tofu can, or what else can they eat? Actually, I don't know, but you can eat noodles.
Rice?
Rice can.
Oh, rice and
can,
soya
but
sauce.
no brown rice. The problem is not, the brown rice is because of the shell, the kernel outside that causes it doesn't digest. So anything that doesn't digest or the body doesn't digest is going to come out from below. It's going to bulk the thing. So you avoid all those.
Any other horror stories for prep work?
Oh, I have one of the classic picture. I have one patient who basically had vegetables that was not digested and it covered the wall of the colon. It's in a picture in my clinic if you want.
Wait, on your clinic?
Like literally, you have the scope pictures, right? Then you see, oh, very nice. Suppose you're all pink and you can see everything quite nice.
Yeah.
I have one picture that is the vegetable is actually plastered on the wall. So you see green color.
Then how?
Cannot see anything. So it's essential. Why it's so important, right? For why the prep is good, because at the end of it, we want to look inside to make sure there are no polyps in the lining. So if it's plastered or covered, I can't see anything. 2, they think why cannot clean properly? The suction to clear is very small. So you think of something like it's like a plumbing thing, right? If the thing to suck out is very small, the hole is very small. There's no way I'm going to be able to wash and suck the whole thing out, lah. So that's why it'll be then unfortunately you'll be called a suboptimal prep. And then I'll tell my patients, oh, I can see maybe certain amount. Like you hopefully
60%.
see,
then how?
Okay, no one's gonna see 100%, even if your prep is really good. Like,
why?
Because there are folds.
So
if you think about it, right? It's not a straight tube, right?
Yes.
So the colon
see.
has it rolls, it folds, it turns, it opens, it closes. It's called peristalsis.
Yeah.
There are folds around it. So even if it's perfectly clear, there will always be a percentage that you can't see. But we try our best.
Yeah. Isn't there AI now?
There's
that
AI and there are
scans
other tools that people use also, but nothing is 100%.
Okay, fine.
Right?
Yeah.
Correct.
So for those people whom you can only see like 40% and it's necessary, then you tell them, hey, look, tomorrow I'll see you again. Drink one more.
So there are 2 ways to deal about this, right?
Yeah.
So those who are really bad, what we do is we have certain methods that we actually inject. We already help them flush. This is what I do. I give them a bit of the prep, like certain fluids in there to help flush it down, and then they have to drink again. So partly I inject from the within, and then they have to drink again. This is to help because already the prep is already done. You've done the hard work, right?
Yeah.
Rather than you go home and drink everything again, we try to help you out.
Huh? How? You mean you wake up, I wake you up, hello, wake
so
up, and
like
then...
while the scope is inside the,
Yeah.
the code, like at the end, right? I will we'll use some fluid to help
Yeah.
flush out, because at the end of it, it's like a fluid thing that flushes things out. So we give it there, but from the top, you also have to drink, lor.
But your GA, you're sleeping, right?
No, when you wake up. Then we do 12 hours later.
Oh, by the way, it's not GA. It's
a moderate sedation.
moderate sedation. Yeah.
But we do again now.
Yeah, so
but
wake
that's
up.
within the same
喝水.
setting. That's within the same setting. But if you cannot, right, then the other thing is you do the scopes. You re-prep again now, which then we know that. So I understand you. Okay, there are a few problems. Some people can't drink all the preparation because it's a lot of fluid. But I always tell them, can you drink 1 pint of beer? You can, okay, you can drink this. But like my mom cannot drink. She has trouble finishing a can of Coke. So if that's the case, right, to drink the amount of fluid to flush the system down is hard for them. So for those who can't drink, then really have to cut down on the things you eat.
Yeah.
But if you can drink, then let's say, for example, this didn't work for you, then you need to add additional 1 liter.
Yeah.
But essentially for the prep, you must be prepared to drink at least about 2 to 3 liters minimum of fluid. I would tell the patients that. Correct. Yeah.
Okay, off topic.
Yeah.
I want to ask you from your experience, because you're talking about a lot of people coming in to see you. From your experience, what is the diet that most people come in with problems? You know, for example, they come in with colon cancer or colon problems. Is there a certain diet? I know that, of course, we can go through reports and then they'll tell you like, oh, smoking.
Okay. In terms of cancer, no, but I do have this anecdotal again. My patients, I know there's certain trigger foods for hemorrhoids.
Hemorrhoids?
Piles.
Isn't hemorrhoids just
Spicy
sitting on the
food
toilet?
Makes it worse. No, they make it worse. And I've got also more than one patient who says beer. When they drink beer, their piles get worse. This is all anecdotal because I hear more than one. I mean, if one person tells me that, it's not. A few will tell me that. I say, So again, it's also the patients have to share things with you.
Yes,
right?
yes,
so
yes,
they're
yes.
open to share things with you. They can share it.
So spicy, for your experience?
Yes, from my experience, it's spicy food makes
and
it
beer.
worse, and sometimes alcohol and beer. Definitely more than one says, I drink beer, I drink alcohol, it's worse. I said, oh. Okay.
And this, and this is from a group of many, many people or just like one person?
Not one I wouldn't bother saying.
Yeah.
Definitely I hear this, maybe I would say out of 10, 2 or 3.
That's a lot.
They will say the same thing. So then when patients ask me, what to avoid? I say, well, it may or may not work for you, but you try this. Like I would say, don't avoid spicy. I mean, if you've eaten spicy food sometimes, and then don't you feel when you go to the toilet sometimes? Let's be all honest, okay?
Always.
We all feel it. So if you have hemorrhoids and it's all flat up, don't you think spicy food is going to make it worse?
Yeah. When I eat mala the next day, I'll feel it, man. Next day, mala will come out.
So if you already know that mala, it makes it worse. And then spices already on a normal person with no hemorrhoids, you feel like that. Then when you have hemorrhoids, even lagi worse.
Jialat, man. Can you imagine you had the night before you had a mala meal with beer?
Yeah. Oh, yeah.
Huh? How?
No, then this patient said mala and durian. Bad combination. Bad combination.
Mala and durian.
That one then he totally
sounds like a full-on celebration,
totally
man.
Flat up. That one.
Yeah, must be his birthday.
But it's quite interesting, lah. So you hear these stories. That's why I said it's definitely. I definitely appreciate when patients share with you because that's the only way you get
extra info.
Yeah, and then you share with other patients. 50 is still the guideline.
Yes.
But based on the rest, we are pushing the age to 45 because of the fact that it's getting more and more common. So I feel that anybody in fact more
you
than
said
40
it. What is it?
What is colorectal cancer? It's true. It's 45. I would say 45. If it's the case, then because you have the Korean society, the American society, I think Australia also, they're all pushing it to lower age group.
Yeah. It's a matter of time.
It's a matter of time.
Yeah.
So I think 50, but you must remember screening is for patients with no symptoms. The essential word of screening is you have no symptoms. You have no pain, nothing, no bleeding, you're well. You're just here to say, okay, I'm here for a check. But once you have all those, as we mentioned before, like bleeding, abdominal pain, change in bowel habits, any age, you go for a scope already.
Okay, so one is called screening, the other one is called...
One is called screening, the other one is called for diagnostic purposes.
Diagnostic.
You no longer, the age group, the age limit doesn't play a role anymore. So I think that's the thing that people have a misunderstanding about. They say, must be 50, then can do scope.
Okay, so remind me the clear difference between screening and diagnostic purpose. Okay. 50 years old...
It's for the Singapore guidelines for colorectal cancer screening, it's 50 years old and above. And screening means you have no symptoms or signs. That means you are perfectly well. passing motion okay, no tummy pain, eating okay, no loss of weight. You're
Yeah.
just healthy.
Yeah, government will still encourage you to go, even if you want to do screening and you're
Yeah,
below
yeah, yeah.
below 50.
No, below 50. I mean, the thing is, if you're below, as in people, they tend to have like, oh, I must be 50 and above, then can do. And then, but they forget that if you have, once you have symptoms, you have problems, the age doesn't matter anymore. You should actually have it checked out, especially if it's a persistent problem.
Yeah.
Yeah, that's why lah.
Got it.
Mm.
What do you think is interesting that you want to talk about?
I always say the most interesting thing is what you see in the scope already lah. I never say
man.
you see worms also, but then
Huh?
yeah, you've seen worms before.
You've seen worms? Common?
Worms. Not
How do
that
they?
common.
Have they been living in there
Scorpion
for
worms. So
long?
when they say, oh, yeah, then we have to start treatment.
What?
I had one, the last one, like to eat sushi. Raw
Wait.
food.
Sushi causes worms?
Sashimi lah.
Causes worms?
Hey, hello, have you not seen the salmon? And then it's on. And the
Inside
worms
your
are
stomach,
down
there's so much like acid and all that.
there.
Would
They
it kill it?
survive lah.
Really?
So those are the fun.
How common are worms in
not
stomach?
common. No, not stomach. Stomach you can't see. It's
Oh, not stomach.
No, we've
Colon.
seen before. Colon seen before.
Doesn't everything just keep passing out?
I don't know why they stay at that corner.
That
we see-
corner?
that, like, we
So
were
how
so
do they
close.
hide? They hide inside the
No, it's
wall?
on the lumen itself. You can see it. The white color, pinworm.
Then as the stomach moves, it just flow out, no?
Don't know. I mean, I guess a lot of it flows out, but we happen to catch it, then we know we have to treat you with it lah.
That's
But
crazy.
But I think it's no longer the horror stuff where last time in the olden days it's the clump of worms, right? You know those olden days where people, you've heard the story
They
before.
so
what?
no.
You never hear the
No.
stories where your last time your grandparents would say so and so.
No,
had
my grandparents do
worm
not tell me
infection.
about
You never
stomach
hear before,
worms.
But they pass out worms, seriously.
Okay, my grandma hasn't been telling me that.
No, got stories when in the olden times are where this is only happens when people go to those exotic places for travel history now. Because
Oh.
now we're clean.
Okay,
They pass out worms.
okay. So what is the main causes? Sushi.
I mean, nowadays sashimi or as I say, travel to exotic places.
Okay,
It
but
depends on what you eat. Most of the time
Yeah.
it's really oral fecal
yeah, but
transmission.
not like the vegetables you eat happen to have like
No.
tiny seeds, eggs.
No. Those are not.
Okay.
These worms are not caterpillar or the earthworm worms. These are actually nematodes. They're actually real
Nematodes.
infective
Yeah.
stuff. As
Yeah.
like they're
Yeah.
real problems. Yeah.
Ooh.
Yeah.
What are the treatment for it?
Medication.
Okay.
If it's mild, they take a course of medicines and clear.
How
it.
many times a year do you see stuff like that?
Nah, once a year.
Once a year is often. Enough.
Maybe not that often. I think in the government practice more because you like people like the foreign workers, you see it.
Oh,
because
they're so
bring
rich,
from their-
eat sushi all day.
No, from their country when they
Okay.
when they first come over here to work. So you see, because I said exotic places,
Yes.
travel history,
Yes.
India, or you go to
Yes.
those kind of countries, right?
I didn't know India's exotic country. Okay.
No lah,
Yeah.
I mean like, or let's say South America,
Okay.
or one of those, you go to the jungle,
Mm.
something like that kind of thing, where the foods are not that clean lah. Then you will see this kind of things.
Yeah.
Sri Lanka, yes. Those are the places that we saw. But this patient was really because she said, I mean, I said, why in the world do you have worms? Because in our culture now, it's very, we
Yeah.
hardly see it.
Yeah.
Then the husband said, okay, she eats a lot. She really eats a lot of sashimi.
it-
Then I
it-
laugh, sorry.
But then again, how bad are worms? They're just living in there,
Yeah.
rent free,
Actually, it's very good. Those very bad worms infection, you lose a lot of weight.
Oh, that's good still, right? For some
It's good,
people.
yeah. Some people, we
Yeah.
never hear before.
No, but you
I
don't
want to
get-
have- I want to 养个虫在里面。
Yeah, but you don't get, like perpetual stomach pain. You don't get, or maybe you do.
Actually, I don't know.
Yeah.
I don't think they.
don't get anything.
That's not the chief complaint.
Then
They
okay
don't-
lah, just let them stay there,
I wonder, why would you want to have a worm inside?
I mean,
I don't mind.
at least you don't
that-
get cancer,
Oh, this one is another topic. Certain type of worm infection, not in the intestine, but in the other part of the gallbladder biliary tree. That kind can cause cancer. That's a
Don't want that.
The one that But
Okay.
so far, I think in the colon don't have lah.
Yeah.
Mm.
Okay, I guess it's almost time.
Yes.
Maybe I can end off with tell me maybe what is some like one of your biggest concerns or
Yes.
biggest message that whenever you meet people you just want to
Yes.
tell them, Is it the diet? Is it the scope? Is it
What do I want to tell them?
yeah. What is the most interesting thing that people don't really know?
Oh, I'll tell you. The statement, I need to go toilet every day to pass motion.
That's
I
normal.
have no, it's normal, it's good habit to have, but it's not a must have.
Oh.
Like they come and
Yes.
tell me, oh, I'm actually constipation is a huge topic. There's so many different definitions of constipation, right? I'm constipated or there's something wrong with my intestines. I'm not going to toilet every day. Again, as I said, it's such a diverse thing. There is no straight rule that says you need to definitely go every day.
Yeah.
So that concept, I don't know why they believe it. Maybe because from parents they tell you.
People's grandmother.
I think it's more important is
Yeah.
how you go toilet. I said,
Yeah.
how do I say this? How your bowel movement is.
Yeah.
It should be, you shouldn't be spending like 20 minutes or 15 minutes in the toilet and all that lah. I
That's
feel
me.
that's okay.
With my
maybe.
phone, I think.
Yeah, so
Yeah.
bringing the phone in is a bad habit.
Okay.
But I think the biggest concept that I think one of the thing is you don't have to go to the toilet every day. I think people will I'm sure there'll be people going up
Okay.
in arms and say, no, I disagree with you, but
Yeah.
I think that's a conception. That's a misconcept that I want to tell my patients. Because
Okay.
if you're obsessed with it, then you go in there and try to strain and try
Yeah.
to push and go
Hemorrhoids.
crazy about it, and then hemorrhoids. Then you start having problems
Yeah.
with that.
Then there
Yeah.
must be a rule. Like how many times is normal
Normal?
for a human being to go toilet? Once a
Ha.
day to how many? You know. How many
How
days?
about this? I've seen we have done tests for patients with slow transit. I've had patients who don't go toilet for 14 days.
And it's normal.
It's not normal. It is not normal. I think there is no, again, I think we accept like 3-4 days. More than that, we call it, there's a term for it, like
Okay.
slow transit and things.
Okay.
But essentially it's the same thing. If you're okay with that, it doesn't cause you side effects. It doesn't cause you to be bloated or you don't feel, you're fine. You're doing everything well. Then every 3 to 4 days, that's how you are. And if somebody
interesting.
goes like twice a day and you've always been twice a day, that's how you are. Unless you are struggling, it affects your life, like you have all the other side effects, then it
lot
has
of
been
pain
worked
lah.
up. Like some people feel a lot bloated. But again, obviously having the stool left inside for too long does increase the risk of cancer lah, which is
Yeah.
why they do encourage regular bowel habits. But that you just can't be obsessed about
Yes.
a certain number because
Yes.
there's no hard and fast rule that says you must go every
Yeah.
24 hours.
Everybody run your own race. Don't
Sort
poop
of.
like somebody else does.
That's true. I like that line actually. And you can put it as a tagline.
Yeah.
Run your own race.
All right,
Okay,
ladies and
all right.
gentlemen, we've come to the end, unfortunately, with
Yes.
Dr. Sharon. I'm pretty sure you guys got a lot of questions, so make sure you write us some comments below on some questions that you have, and we will certainly have Dr. Sharon back on the show, and we'll
Try to
ask her
answer. Yeah.
all your questions.
All right.
Take
Thanks.
care.
All right.
See you in the toilet. No, we won't see you in the toilet.
That's
See you in the toilet more than once a week, for sure, right?
Well,
Twice a week, minimally.
Yeah, I don't think it's a minimum, but keep it regular and don't
Yeah.
don't strain.
Keep it chill. See you
Yeah,
guys.
bye.
Bye-bye.